Cardiologist warns, never take vitamin B12 with these two common medications after 60. An urgent and important warning for individuals over 60 regarding a crucial aspect of their health. If you are an older adult and routinely take vitamin B12 every morning, please pause for a moment and give your full attention to this vital information before you consider your next dose. What we are about to discuss concerns millions of seniors who believe they are proactively caring for their well-being, yet might be unknowingly exposing themselves to significant health risks. At this very moment, something profound and concerning is unfolding silently within the bodies of countless older individuals. The most troubling aspect of this situation is its insidious nature. It doesn't manifest with pain, dizziness, chest pressure, or any other obvious warning signs that would prompt you to set down your morning coffee and immediately contact a healthcare provider. Instead, it operates below the radar, an unseen force that, over time, can significantly elevate the risk of serious health complications such as strokes and heart damage. Many people diligently follow their health routines, including taking recommended supplements, in the sincere belief that they are doing everything correctly to maintain their health. However, one of the most trusted and widely consumed supplements, vitamin B12, can, under specific circumstances, pose an unexpected danger when combined with certain common medications. This is a critical interaction that, regrettably, many healthcare professionals do not routinely warn their patients about. When vitamin B12 is taken in high doses and combined with one of these two common medications, it can trigger the production of a molecule known as homocysteine. This molecule, when present in elevated levels, behaves like a coarse abrasive, effectively sanding away at the delicate inner lining of your arteries. This constant irritation and damage significantly multiply the risk of experiencing a stroke, a truly devastating health event. Today, we are going to meticulously explain precisely which two medications are dangerous to combine with B12 once you've passed the age of 60. Even more importantly, we will detail how you can effectively protect yourself from these potential dangers. It is absolutely fundamental to grasp that this scenario is far more prevalent than most people realize and has the potential to affect anyone who adheres to a regimen of supplements and medications without having the proper comprehensive knowledge of their interactions. The cornerstone of protecting your health in this context lies in acquiring accurate information and understanding how to manage your well-being proactively. Before we delve deeper into the specifics, there's a compelling piece of data worth noting that sheds light on the unexpected complexities of vitamin supplementation. A significant study, published in a highly regarded medical journal, revealed a counterintuitive finding that surprised many within the medical community. This research indicated that older adults who were consistently taking high doses of B vitamins, which included B12 over an extended period, actually demonstrated an increased risk of cardiovascular issues under certain specific conditions. This was in stark contrast to individuals who were taking lower doses of these same vitamins. Far from seeing a decrease in risk, there was an observed increase, which initially puzzled many researchers. However, once the underlying biochemical mechanisms were understood, the findings began to make perfect sense, illustrating the delicate balance within the body's systems. Consider the illustrative case of a 71-year-old individual who was remarkably lucid and energetic. Having enjoyed a fulfilling career as a school teacher before retiring, she maintained an active lifestyle, including daily morning walks. Her breakfast routine included taking a handful of supplements, a practice she adopted because she had read extensively about how the body's ability to absorb nutrients can change significantly after the age of 60. Vitamin B12 was a high priority in her daily supplement regimen, and she took great pride in her proactive approach to maintaining her health. What this individual was unaware of, however, was a critical interaction occurring internally. She had been taking metformin for her type 2 diabetes for nearly 8 years. Throughout this considerable period, no one had ever explained to her the long-term effects of metformin on B12 absorption, nor the cascade of events that transpire when the body attempts to compensate for such a prolonged deficiency. One day, her daughter began to notice that her mother was experiencing an unusual level of tiredness, far beyond what could be remedied by a good night's sleep. It was a persistent, deep-seated exhaustion that the mother herself simply attributed to the natural process of aging. When comprehensive blood tests were finally conducted, including a specific measurement for homocysteine levels, the results unveiled a pattern that, regrettably, was becoming increasingly common among older adults. Her homocysteine levels were found to be dangerously elevated. Paradoxically, her B12 levels also appeared high on the lab report, a direct consequence of her consistent supplementation. However, the combination of these two seemingly contradictory results painted a chilling picture, a narrative of silent, progressive vascular damage that had been quietly developing over many years, all while the individual believed she was meticulously doing everything right for her health. This poignant story serves as a vivid illustration of how the seemingly benign combination of B12 and certain medications can inadvertently create a significant health problem, one that standard medical checkups often fail to detect, leaving individuals vulnerable to unforeseen complications. The first medication that warrants our immediate attention is metformin. If you have been diagnosed with type 2 diabetes, there is a very high probability that you are currently taking this medication. It stands as one of the most widely prescribed drugs for effectively managing blood sugar levels and is genuinely recognized for its efficacy in this regard. However, metformin comes with a significant side effect, a consequence about which the majority of patients are unfortunately never clearly informed or educated. Over time, and particularly after years of consistent use, metformin begins to interfere with a crucial protein located in the gut called intrinsic factor. Think of intrinsic factor as a specialized transport vehicle, a kind of internal taxi service within your stomach. This protein is produced by your stomach lining, and its sole purpose is to act as a dedicated carrier for vitamin B12. Without it, B12 cannot be properly absorbed into your bloodstream and delivered to where it's needed throughout your body. Metformin, in a remarkably silent and undetectable manner, gradually impairs this intricate transport system, rendering it less reliable and less consistent in its function. The consequence of this interference is often seen in routine blood tests, where a healthcare provider might observe visibly low levels of B12. Logically, in response to such a finding, the physician will typically recommend that the patient begin taking a B12 supplement to correct the perceived deficiency. Following this advice, the individual then proceeds to purchase a high-dose B12 supplement, often operating under the common misconception that when it comes to vitamins, more is always better. For a period, their blood B12 levels will indeed rise, and their doctor, relying solely on the standard blood work, will likely indicate that everything appears to be in order. However, what that routine blood analysis fails to reveal is the critical process unfolding downstream. When B12 cannot be properly processed and transported throughout the body due to the damage inflicted upon the intrinsic factor system, it begins to interact in an undesirable way with another molecule present in the blood, homocysteine, and it is precisely at this juncture that the situation escalates, becoming genuinely dangerous and potentially life-threatening for the individual involved. Homocysteine is a naturally occurring amino acid that your body produces as part of its normal metabolic processes. In small, controlled quantities, it is entirely harmless and is typically managed efficiently by your biological systems. Our bodies rely on a group of B vitamins, specifically B12, B6, and folate, to effectively convert homocysteine into other useful compounds or to facilitate its removal from the bloodstream, thus keeping its levels in check. However, when this vital conversion process is disrupted, for instance, because B12 is not being absorbed or processed correctly homocysteine begins to accumulate in the blood. Elevated levels of homocysteine in the bloodstream have a very specific and remarkably damaging effect on your cardiovascular system, acting much like abrasive sandpaper against the delicate inner lining of your arteries. In fact, a team of researchers at a highly esteemed medical institution vividly described this phenomenon. They explained that elevated homocysteine doesn't cause a sudden acute blockage, as might occur with a blood clot. Instead, its action is one of chronic abrasion. It systematically inflames the arterial wall, causing it to become rigid and significantly more susceptible to the formation of plaque deposits. Furthermore, it impairs the ability of the blood vessel to expand and contract flexibly, a crucial function for healthy blood flow. To visualize this, imagine your arteries as supple, flexible rubber hoses. When they are in a healthy state, they effortlessly stretch and recoil with each beat of your heart, allowing blood to flow smoothly and adapt to pressure changes. However, when homocysteine has been persistently scraping and irritating those arterial walls for months or even years, the hose begins to transform. It becomes less like a flexible rubber conduit and more akin to a rigid plastic pipe. And rigid pipes, as we know, are prone to cracking. They do not flex gracefully under pressure, but rather, they can suddenly fracture or rupture. Within the delicate and vital cardiovascular system, such a rupture can have catastrophic consequences, often manifesting as a stroke or a severe cardiac event. This is why it is absolutely crucial to be aware of this specific interaction, especially if you have been taking metformin for an extended period and are also supplementing with B12. This particular combination of metformin and B12 supplements is silently occurring within the bodies of countless individuals every single day. Yet tragically, very few people, including many healthcare providers, are connecting these critically important dots. Now, let's turn our attention to the second medication that is equally important to discuss. This particular drug is even more widely consumed than metformin, and its interaction with B12, while different from metformin's mechanism, is in some respects even more unpredictable and potentially perilous. We are referring to a class of medications known as proton pump inhibitors, commonly abbreviated as PPIs. These include widely recognized brand names such as omeprazole and pantoprazole. Their primary function is to reduce the amount of acid produced in the stomach. They are routinely prescribed to alleviate symptoms of acid reflux, mitigate damage caused by excessive stomach acid, and provide protection against ulcers. PPIs are extraordinarily common among older adults, largely because acid reflux tends to become more prevalent after the age of 60, as the digestive system naturally undergoes various changes. However, PPIs perform another action that most people never hear about when they pick up their prescription at the pharmacy. By significantly reducing stomach acid, these medications diminish the very acidic environment that is essential for the body to properly release B12 from the foods we consume. Your body requires a sufficiently acidic environment in the stomach to break down the protein bonds that naturally hold B12 captive within food sources. When this crucial stomach acid is suppressed by a PPI, and this suppression continues over months and even years, the absorption of B12 directly from your diet decreases significantly. A study published in a highly respected medical journal, which meticulously tracked over 25,000 patients undergoing long-term PPI therapy, found compelling evidence of this. After just 2 years of continuous PPI use, patients showed measurably lower serum B12 levels compared to those not on the medication. Upon discovering such a finding, what do most healthcare providers typically do? Logically, they recommend a B12 supplement, which on the surface appears to be a sensible course of action to address the observed deficiency. However, the core of the problem lies in the fact that in certain individuals, particularly older adults who may have reduced kidney function, the supplemental B12 is not processed or eliminated from the body as efficiently as it should be. Instead, it begins to accumulate in the bloodstream, taking on a form that interacts inefficiently and sometimes detrimentally with the crucial homocysteine cycle we discussed earlier. But there is an additional layer to this complex process that is particularly concerning and adds another dimension of risk. Some patients who are on long-term PPI therapy can develop a condition known as rebound acid hypersecretion. This means that when they discontinue their medication, or even as the drug is metabolized and its effects wear off overnight, their stomach responds by producing an excessive amount of acid in a compensatory reaction. During this specific rebound window, any high-dose B12 supplement taken is processed in an entirely unpredictable environment. This erratic absorption means an equally erratic management of homocysteine. On some days, the body's system might effectively clear the homocysteine, while on other days, it may not, leading to harmful accumulation. This is a profoundly complex situation that introduces an additional layer of risk and powerfully underscores the critical importance of engaging in a detailed and open conversation with your healthcare provider about all the medications you are taking, both prescription and over-the-counter, as well as any supplements you are using. This comprehensive discussion is essential for your safety and well-being. This is where all the pieces of information we have covered thus far seamlessly converge. The central connection of homocysteine lies at the very heart of this entire problem, serving as the common denominator. Homocysteine is one of those crucial health markers that almost never appears on a standard blood test panel. Your doctor typically checks for your cholesterol levels, blood sugar, thyroid function, and perhaps even your total B12 level in isolation. However, measuring homocysteine specifically requires a separate and distinct blood test, one that must be explicitly requested. Leading experts in cardiovascular health have consistently identified elevated homocysteine as a significant, yet largely underestimated risk factor for cardiovascular diseases in adults over the age of 60. Despite its critical importance, the vast majority of older adults have never had their homocysteine levels measured in their entire lives. The reason why this oversight is so profoundly important is that when your homocysteine levels remain elevated for extended periods, spanning months and even years, three detrimental processes begin to unfold within your cardiovascular system. Firstly, the delicate inner lining of your arteries, known as the endothelium, becomes chronically inflamed and begins to lose its natural smooth and protective surface. This makes the arterial wall more vulnerable to damage. Secondly, small oxidized particles of LDL cholesterol find it much easier to embed themselves into these inflamed and roughened arterial walls, initiating and contributing to the formation of harmful atherosclerotic plaques. These plaques gradually narrow and stiffen the arteries, impeding healthy blood flow. Thirdly, and this point is absolutely crucial for understanding severe cardiovascular events, the plaques that form in an inflammatory environment with consistently high homocysteine are significantly more prone to rupturing in an unstable manner. This means that instead of remaining fixed to the arterial wall, these unstable plaques are far more likely to break off, releasing fragments that then travel through the bloodstream. This final point precisely explains the occurrence of strokes in individuals who, upon medical imaging, do not appear to have major, visible blockages in their arteries. The plaque was indeed present, but its unstable nature, exacerbated by high homocysteine, caused it to detach and create a blockage elsewhere. Researchers at prominent clinical institutions have uncovered compelling evidence showing that elevated homocysteine is disproportionately present in a significant number of these seemingly unexplained strokes. In many such cases, the cause was not truly mysterious. It was simply that the appropriate diagnostic test, a homocysteine level measurement, was never ordered or performed. This information is not intended to instill fear without purpose. Its true aim is to empower you with knowledge, returning the control over your health back into your hands. Now that you have a comprehensive understanding of what transpires within the body under these specific conditions, we will outline the concrete steps you can take to address and mitigate these risks effectively. The crucial answer here is not to cease taking B12 altogether. Vitamin B12 is, without a doubt, truly essential for numerous bodily functions, especially as we age beyond 60. Its deficiency can lead to a cascade of debilitating issues, including nerve damage, pervasive fatigue, cognitive impairment, and yes, even its own set of cardiovascular risks. Therefore, the objective is not to reduce your B12 intake, but rather to approach its supplementation in a much more intelligent and informed manner. Firstly, if you are currently taking metformin for diabetes or an IBP, such as omeprazole or pantoprazole for acid reflux, the single most important action you can take right now is to contact your healthcare provider. Request that they specifically test your homocysteine level. Additionally, ask for a measurement of your active B12 level. It is vital to specify active B12 and not just total B12 in your blood. Total B12 levels can sometimes appear normal on a standard test, while your active B12, which is the form your body can actually utilize, may be dangerously low. This distinction is absolutely critical and is often overlooked by many routine blood analyses, leading to a false sense of security. Secondly, the specific form of B12 you are taking matters enormously. The vast majority of B12 supplements available in retail stores and commonly purchased contain cyanocobalamin. This is the cheapest form of B12 to manufacture, and it requires your body to undertake several metabolic conversion steps before it can be transformed into a usable, active form. For older adults, particularly those who are taking metformin or an IBP, these crucial conversion pathways are often compromised or less efficient. In contrast, the form known as methylcobalamin bypasses most of these conversion steps, as it is already in an active, directly usable state for your body. Research published in specialized scientific journals has consistently demonstrated that methylcobalamin more reliably elevates functional B12 levels in older adults compared to cyanocobalamin, even when administered at equivalent doses. Choosing the right form can make a significant difference in how your body utilizes this vital nutrient. Thirdly, the dosage of your B12 supplement is far more important than most people realize. High-dose B12 supplements, commonly ranging from 1,000 to 5,000 micrograms daily, are widely sold and frequently taken by individuals. However, without the proper function of intrinsic factor, your body can only absorb a very small fraction of these excessively high doses. The remaining unabsorbed B12 then floods your bloodstream in a form that, as we've discussed, can inadvertently fuel the homocysteine imbalance, exacerbating the problem rather than solving it. A more judicious and specific dose, typically ranging between 250 to 500 micrograms, when taken in the active form of methylcobalamin and combined synergistically with both B6 and folate, provides the homocysteine cycle with precisely what it needs to function correctly. This approach supports optimal metabolic conversion without overwhelming or oversaturating the system, which can be counterproductive. Fourthly, and this cannot be stressed enough, engage in a candid and specific conversation with your healthcare provider about your complete list of medications in relation to your supplements. Do not treat this as a casual inquiry. Make it a dedicated agenda item for your next appointment. Explicitly state, "I want to have a detailed discussion about my B12 supplementation in the context of the medications I am currently taking." This proactive and focused conversation alone holds the potential to significantly alter the trajectory of your cardiovascular health for the better. Consider the compelling case of an individual, aged 74, who had been on an IBP for 14 years and had been supplementing with B12 for the latter 5 of those years. Her daughter, having encountered alarming information about homocysteine and its link to heart health, brought her mother to a medical appointment armed with a printed article. Initially, the mother was skeptical. She felt perfectly fine, her blood pressure was well controlled, and she enjoyed walking her dogs daily without issue. However, her homocysteine blood test results delivered a stark reality, a level of 31 micromoles per liter. The universally accepted safe range for homocysteine is below 15. At 31, her level was more than double the threshold associated with a significantly elevated risk of stroke. Yet she had experienced no symptoms, no overt warnings, and no clues whatsoever, only a number on a lab sheet that precisely explained why her arteries were enduring far more stress and damage than they should have been. Following these critical results, several beneficial changes were immediately implemented. The form of her B12 supplement was switched to methylcobalamin, which is more directly usable by the body. A low-dose supplement containing both B6 and folate was added to her regimen to provide crucial support for the homocysteine conversion pathway, ensuring it functioned efficiently. Furthermore, her B12 was strategically scheduled to be taken at a different time of day than her IBP dose, aiming to maximize its absorption. A follow-up homocysteine test was scheduled for 90 days later. When the individual returned to the clinic 3 months subsequent to these changes, her homocysteine level had significantly decreased to 17. While not yet perfectly within the ideal range, it was undeniably moving in the correct and healthy direction. She candidly remarked that she hadn't truly realized how deeply tired she had been until she began to feel a profound sense of renewed energy and less exhaustion. If you recognize yourself in a similar situation, having followed a problematic regimen for years, please know that it is not too late to make a positive change. The human body possesses a remarkable inherent capacity for recovery and rebalancing when it is provided with precisely what it genuinely needs. The vascular inflammation caused by elevated homocysteine is not necessarily a permanent condition, especially if it is detected and addressed before a major cardiovascular event occurs. This inspiring case study powerfully demonstrated significant improvement in just 90 days, offering a strong message of hope. Here is a clear and actionable plan for you to safeguard your cardiovascular health based on the insights we've shared. First, diligently review your current medications. Are you taking metformin for diabetes, or a PPI such as omeprazole or pantoprazole for acid reflux? It is absolutely essential to have a comprehensive and accurate list of all your prescribed and over-the-counter medications. Second, carefully examine your existing B12 supplement. What specific form of B12 does it contain? If the label indicates cyanocobalamin, you need to seriously consider switching to methylcobalamin. This form is much more directly usable by the body, a critical factor, especially for older adults whose metabolic conversion processes may be compromised. Third, verify the dosage of your B12 supplement. If you are regularly taking more than 1,000 micrograms daily, you are likely oversupplementing, and this excessive dose could actually be counterproductive to your health goals rather than beneficial. A more moderate and specifically targeted dose, as discussed, is often far more effective and safer. Fourth, make it a priority to schedule a homocysteine blood test. Call your doctor tomorrow and specifically request a test for your homocysteine level, along with a measurement of your active B12 level. Do not settle for just a total B12 reading. Insist on having your active B12 measured, as this provides a more accurate picture of your functional B12 status. Fifth, consider integrating supplemental support with B6 and folate into your routine. These two vital vitamins work in powerful synergy with B12 to process homocysteine efficiently and appropriately, thereby optimizing the crucial metabolic cycle that manages this molecule. By supporting all three components, you create a more robust system for homocysteine clearance. What you have learned today is this: the combination of metformin and B12 can create a dangerous interaction through the intrinsic factor pathway, ultimately leading to elevated homocysteine levels and progressive arterial damage over time. Similarly, proton pump inhibitors effectively reduce the acidic stomach environment necessary for proper B12 absorption, leading to an erratic processing environment that disrupts the delicate homocysteine cycle. Crucially, homocysteine levels are almost never routinely analyzed in a standard blood panel, yet elevated levels in older individuals represent a significant and dangerously underestimated cause of strokes and other major cardiovascular events. The definitive solution to this complex problem is not to discontinue B12 altogether, but rather to transition to the more bioavailable form of methylcobalamin, taken at a more intelligent and appropriate dosage, and supported synergistically by both B6 and folate. If this critical information has helped you comprehend a potential danger to your health that you were previously unaware of, please take a moment to share it with someone over the age of 60 who may be taking these specific medications. Your simple act of sharing this knowledge could quite literally save someone from experiencing a devastating stroke or another serious cardiovascular event. This information is intended for educational purposes only and should never be considered as medical advice. Always consult with your qualified healthcare professional before making any changes to your supplement regimen, especially if you are currently taking prescription medications. Thank you for trusting this source for your health education today. Now you possess invaluable knowledge that most people are never told, and that knowledge rightfully belongs to the people you care about as well. Take good care of your heart.